The purpose of our organization is to provide evidence-based information to our county council to help them make good decisions for the health of our community. The members of our commission are local community members, so it's important to be able to bring our areas of expertise into the commission so that the information that we give to the county council is evidence-based and trusted by the community.
The Health and Wellness Commission, it couldn't come from a better spot than from them because they're members of the community that work in the community, understand the community. It's much better from my perspective for it to come from an entity such as that than to come from the government. I don't know the community as well as they do, and so it's always better for me to partner with entities such as the Health and Wellness Commission.
The journey on adopting a comprehensive smoke-free ordinance started back in 2010 actually. And at that time, people were allowed to smoke indoors, in restaurants, bars, workplaces, businesses. And of course, now we know that secondhand smoke is really harmful to our health. In fact, according to the CDC, nearly 41,000 people die every year prematurely from secondhand smoke alone in the US. So, due to that alarming data, the Commission decided it's time to pursue a countywide smoke-free ordinance.
The vast majority of people want to breathe clean air. Lancaster County, fortunately, they were one of the first ones. Actually, I think we're the very first one to pass tobacco-free ordinance.
And so it was our job as the Commission to keep the community informed and alert of, the different prevalent data trends that were occurring, what was happening with the youth vaping epidemic. And really, to achieve that health equity, we had to focus on the community as a whole. And that would include the youth, that would also include marginalized populations that have been and continue to be targeted by the tobacco industry. For decades, they have targeted historically marginalized populations, lower socioeconomic populations, to their deadly harmful products. And unfortunately, those communities face high food insecurity rates, which is that lack of access to healthy, affordable foods. And if you're living, in a situation where you're not having enough food on the table, you don't have transportation, you don't have daycare, all these different social determinants of health that impact someone's life and their quality of life, you're more likely to use these products to cope and deal with that stress and that anxiety.
So we partnered with Food Share to be able to make these options available to our local community. Some of our commission members help pack these boxes, and they're available for low cost to our community members.
Food Share boxes provide a very good source of nutrition for the residents here in Lancaster County, considering that Lancaster County is somewhat of a food desert. So it's very important that whatever they're providing is going to be very healthy for them. A lot of the clients that I service are below the poverty line and just are unable to afford healthy foods, so especially fresh fruits and vegetables.
The Getting Further Faster initiative has helped the Lancaster County Health and Wellness Commission in a number of ways. An important way is in policy making. They've helped us look to the past and the policy work that we've done and be able to hone our ability to create even more effective policy in the future. And the Getting Further Faster program has really understood that there's not a one-size-fits-all approach, and they've helped tailor their tools and advice to the needs of our community.
The Health and Wellness Commission has been great, really about the smoke-free, tobacco-free effort. I think has really been a hallmark for this commission to really say something tangible about how they're making improvements. But really, even when you think about the other health issues, very much about doing the community partnerships, engaging with the Food Share program at Hope, even thinking about our farmers market, really trying to bring all these pieces together. You think vaping and tobacco, that's one aspect. You think about food insecurity, that's another aspect. You think about poverty issues. So really having that holistic approach has been the signature, I think, for this organization.